Hello, I'm Carissa.
And I'm Carissa.
This is just a quick introduction of our business skin firm. We are going to be a medical spa located downtown Corbin. We're going to have 2 injectors, myself and my sister, who's actually the business owner, Sabrina Lambert, and then we'll have Carissa.
And I'll be the esthetician there. Just a couple of things that I'll offer is dermaplaning, chemical peels, microdermabrasions, a few of the basics. We hope to expand a little bit more in the future, but we cannot wait to get started.
Okay, so very soon we're going to start posting lots and lots about our business. We'll be posting the location, specific address, phone number, all that kind of details. We have a website. You'll be able to make appointments, and individually you'll be able to book one with Carissa, Sabrina, or myself. So very exciting.
Yeah, you'll have to be sure to follow us. Whether you're seeing this on Facebook, be sure to follow us on Instagram, or whether you're seeing this on Instagram, follow us on Facebook.
And we'll link all those details very soon.
Okay, so we compiled some questions that I frequently get asked about Botox, and Carissa gets frequently asked about Botox. And we plan to do a follow-up video talking about a little bit more specifics, but for today we're just going to talk about the basics. So maybe if you haven't gotten Botox yet and that is something that you're very interested in, these are probably a couple of questions that you have been asking or want to know. So Carissa, first let's start out with what is Botox and how does it work?
Okay, so Botox is a neurotoxin. It basically inhibits the movement of the muscles in your face. So we'll inject in specific locations and it will help decrease the wrinkles. In those lines that you have, the collagen will start building and help prevent wrinkle formation.
Okay, so speaking of wrinkles, because I feel like that's a huge concern for everybody, can Botox make wrinkles disappear?
So we can make them practically disappear for a short period of time, but eventually the Botox is going to wear off and you will go right back to where you started if you let it completely wear off. We can prevent further wrinkle formation, but I cannot get rid of the wrinkle you already have. I can prevent it when we keep injecting.
Okay, so talking about wrinkles and the prevention of wrinkles, I guess, are there any few long-term effects that Botox can have?
Eventually the Botox is going to wear off and your wrinkles will be just like they were when we first started. So typically that's around 3 to 6 months for everybody. Normally by 6 months the Botox is completely worn off. So over time your wrinkles will appear better, but eventually you're just going to go right back where you started. So if you end up hating it, it's going to be okay because it's going to wear off eventually.
But if you do want the long-term effects,
you just
consistency is key.
Yep, just keep injecting.
Okay, so a lot of questions concerning this. How long does the Botox actually take to work? And we had 2 little feet run across the room in her little pajamas after nap time. We kind of got... how long does it take to work and how long does it last?
So when you first get injected, everyone is a little bit different. It can take 2 to 5 days before you start seeing anything. A lot of people who first have their injections done, they may see it as early as 2 days, but as time goes on, you may not notice it to more 5 days. Definitely by day 7, you're gonna see some results. It will take 2 full weeks to get the max results of your injection. So at that point, at 2 weeks after we inject you, we can do a touch-up or inject more if you're not happy with what you got. And then we kind of answered this a little bit in the previous questions. It will take 3 months to 6 months for it to completely wear off. Everybody's a little different. Some people, it's a little less than 3 months, some people a little more than 6 months, but sometime in that time range, you're gonna notice more movement and you're gonna wanna come back for more injections.
Okay, and another big question that I get asked a whole lot, how many units what's an average number of units that a person typically needs, maybe especially the ones that have never had it before or it's completely worn off? specifically never had it before? What's the average number of units that you typically inject on someone?
So I would say you're going to expect to get at least 30 units the first time. Most people, we need to inject at least 20 in your 11s, or if you just have one line there in the glabella region, and then your forehead minimum probably 10 units. So you're talking at least 30 units from the first injection time. Now if you do crow's feet, that minimum is probably 12 units, anywhere from 12 to 24. So kind of gives you an idea of what you would start with.
So really, it's what your concerns on, what your concerns are, and what you want to target. So with that being said, and the number of units that you need, for those that are more concerned or holding back from budget purposes, is there a way to do Botox on a budget, would you say?
It's really hard to, if you want to do between your eyebrows and your forehead, to not do it all at the same time. I'm always going to recommend the lowest amount possible to get you the look you want. But it's really, really hard to inject between your eyebrows and then not inject your forehead as well, because in 2 weeks what's going to happen is you're going to look awesome in one area and the other area is going to be really wrinkled and you're not going to be very happy, and almost everyone I do that to comes back. So generally, if you want to do your 11s and your forehead, you need to do that all at one time, and then maybe save your crow's feet for a month later and do your crow's feet.
And Carissa doesn't know I'm about to ask this question, but something that I also think that people are kind of holding off on Botox for is they're scared of that frozen feeling. So, or that frozen look maybe. I personally, nobody's ever commented that to me, and nobody can ever really even tell that I have Botox. So, you know, just saying to people, there is a way, you know, there's obviously the bad Botox jobs. We've all seen the bad Botox jobs. But that isn't the case. You know, it's all about your injector. And I feel like Carissa is very mindful about maintaining the natural look. So,
our goal is at Skinform to use what you already have and enhance it. We want you to just look youthful, but not terrifying, I guess is the best way to put it. So, I mean, I will not use too much Botox so that you look frozen completely. I like a more natural look. Now, I will do that if that's what you want, of course, but I like the whole, I'm just youthful, natural, look great, look 20 years younger, 10 years younger, whichever.
Yes, and then like myself, I was a little bit scared at first, because the first time Carissa injected me, we had, you know, you started with a low number, and then I came back because you did the touch-up, because there was just a little more movement than what I wanted personally, and we touched up, and I've loved it ever since. Okay, so a common misconception that I know people have when they talk to me about Botox is they think it could be too early or it's too late. So what are your suggestions on those two things?
Okay, so in our late 20s, early 30s is when collagen starts decreasing rapidly. We quit making the collagen, so we start developing more and more lines on our face. So ideally, the time to start Botox is when you start to get lines on your forehead. So when you're just resting and you have a little indentation in your face, it's the time, because that's the perfect, I can fix it and make it totally back to when you're 20 all over again. So when you notice those lines, best time to start. It's never too late to use Botox. I can't completely take away the lines if they've been there for a long, long time. So if you pull the skin tight on your forehead or whatever spot you're worried about and you still have a line there, I cannot get rid of that line. I can prevent it from getting worse with Botox, but I can't take away the tension that's already created there.
So it's all basically about prevention, really.
Yes, Botox is prevention.
And last question for the day, but certainly not least, some people are standoffish for getting Botox. So maybe just talk about some of the side effects that they could experience.
Most side effects are all localized. There are no reported systemic side effects, which means nothing that affects your entire body. So it's going to be right at the injection spot. Some people have a little bit of soreness there. They may have some bruising, some swelling, some redness, but typically that goes away just in a couple days. You can always put ice on afterwards to help. We can put ice on before, but there are no long-term entire body side effects of getting Botox. You can always, people are worried, well, can you inject too much? You have to inject an incredible amount. I'm talking vials and vials and vials of Botox to have a reaction in your body. You'd have to have a complete error. Like, there's no way I can possibly inject too much Botox in your skin.
And even if there is a place that has been injected and you don't like the non-movement in that place, it wears off.
Yeah.
It wears off.
It will wear off. Unfortunately, it will wear off.
We wish it didn't.
No, exactly. So now that we've answered some of the most common questions, we're going to move on. Carissa is due for a little touch-up. She has a little unwanted movement. So we are going to do some injections and show you how it goes. So Carissa's here. She has a little unwanted movement in her forehead. It's been 3-ish months since she's had it done. So we're just going to touch her up. Now Carissa gets hers religiously every 3 months. Or that's typically the time frame, around 3 months. So she really, in the beginning, we had to use a whole lot, but since she comes every 3 months, we don't have to use as much. So we're just going to quickly, I'm going to wipe her head off here. And then I'm going to mark the injection sites. So if you'll just raise your eyebrows for me. Okay, just going to do a couple little dots here. And this just shows right exactly where I'm going to inject. Okay, so we're just going to start on the outer side here, inject a tiny little bit in each location. Most people say it's not super painful at all. It just stings a little bit. Mm-hmm. And then there's like a crunchy sound sometimes when you inject.
So how many units are going in each spot?
So each spot we're doing 2 units for a total of 10 units. And that is it. Thank you for tuning in with us today, and we are excited to serve the Tri-County area with Botox and all the esthetician needs. So you can book your appointment with us. Hopefully we'll be in the spa very, very soon after some of this craziness slows down a little bit. So you can private message each of us to make an appointment. We'll post our website very soon so you can make appointments, or you can call us at 344-7546.